Welcome back to Move Better, everyone. Today I have with me Jess Mather from Gainesville, Florida, and Jess is a strength and rehab professional and an educational provider as well. And today we're going to talk about trauma-informed care, and I'm very excited to have you on, Jess. I love being in your Facebook group and learning, and I know you're doing great things in the world of rehab and informing people about trauma. So tell me, how did you uh, get into this field, and how did you get here today?
Yeah, so I've been in the world of strength and rehab for over a decade now, and I love the feel. So I started there first, just my love of movement in general. And then because I was in the rehab field, I started working with more people, obviously with pain versus when I first started as a personal trainer. And then I had my private practice that I've had about 7 years. And what I noticed in my private practice of strength and rehab, so essentially my private coaching practice, I was taking on people who happened to come in with chronic pain, who wanted to, excuse me, get stronger and move better. So I started getting a lot of clients with pain. And as I started to learn about my own body, my own self in general, and then started to see these correlations between chronic stress, trauma, and pain, I started to see this also show up in all of my clients. So I started to get really inspired to explore these connections. Since opening up that, my mind to that, the right mentors and teachers and training started falling into place. And I was just blown away at the connections between pain and trauma, trauma and chronic disease. Actually, I have one of my books right in front of me that my phone's sitting on about the connections between the stress and disease connection. And I didn't see a lot out there on it, at least when I first started getting into it over 5 years ago. Now we were starting to see more. But even still, we're not seeing a ton on trauma-informed care and trauma in general in our fields in physical therapy and some different departments of the healthcare. So I said, well, then I'll take care of that. I'll start building that community and building that movement and that vision.
That's awesome. So what does uh, what does it working with you look like? What does that entail?
In terms of the private coaching work?
Yeah, private coaching.
Yeah, so how does it look? I actually had to film a video on this because clients would ask me, what does it look like to work with you in a private session? And it was hard to describe. I managed to film a video on it. So I'm going to try to reference back on what I did in that video a year or so ago. Because I often say when we incorporate trauma-informed care into our work, it doesn't necessarily look very much different. We're not doing crazy, cuckoo, weird things all of a sudden. So much about it is in the subtle things that we're doing and the way that we're communicating, for example, the way that we're not kind of forcing clients to do things, for one, right? Sometimes they'll be like, we're going to do this, we're going to do this. There's this kind of energy. And my clients will come to me with this kind of energy, if you know what I mean. It's like, we got to do this. Versus one of the guiding principles I use in my work is the body knows best. And if we're not really paying attention to the pace that the body needs, then we're going to drive through and we're going to increase the risk of a pain response, increase even sometimes trauma coming back up too much. So that's one example, is moving slower, moving at the pace of the body, being able to pace appropriately, know how to do that by watching that person's body, the signs and symptoms that we're starting to do too much too fast. Creating more empowerment in a session by the language that we use, instead of, again, kind of forcing and we're going to do this, providing choice and options for them to choose what they want to do so that they feel like they're a part of the process. So many people will go to a doctor, a therapist, a personal trainer, and they look at us as the authority, right? It's like, I need to listen to them and they're going to fix me. But that can put them in that place of disempowerment. And often people who come from trauma, or, sorry, that's my dog, complex chronic pain, they're already coming from a place of disempowerment, already coming from a place of weakness. And we want to use our language and the way that we're working with that client to reinforce their own resilience and their own empowerment. Those are a few examples. I could probably go on, but those are a few. Does that make sense?
Yeah, no, that, I think empowering patients, I think a lot of times, like you said, people come to us and they're like, okay, fix me.
Yeah.
And either they're on high alert or they've been so, or, well, it's usually the ones that are high alert, like just fix me, I want to get back at what I'm doing, and not actually, give me what I need to do, and that's it. And like, okay, well, how does it feel? What does it feel like in your body? Can we, do you like to do this? And putting that, I think, is important. And I think we don't always think about that. We think, okay, external rotation is going to fix your rotator cuff.
Yes.
Do these external rotations 5 times a day. And that's not, and maybe it hurts, or maybe it's, maybe they can't do that, or whatever reason. So I think it's, empowering and like giving back ownership to the client and the person to help them, because what they embrace doing is going to be more of what they want to do, and it's going to help them in the long run. So
I totally, that point's really important too. Like making them feel like they're part of the process instead of just kind of following what you're doing. And like you said, what does it feel like when you're doing? That's a huge part of it too. Is I tell them on the front end, I'm like, I'm going to ask you a lot of questions. It might feel a little bit, intense. I'm going to be asking you constantly, what is this like? What are you experiencing here? And you have to be careful with that with somebody with trauma, because sometimes when you ask them to feel sensations and really tap into their body, one, they can get frustrated because they might not have access to that, right? So they're like, I don't understand what you're asking. Normalizing that's okay, right? Oh, that's okay. Like we're just exploring. Sometimes I'll use the word playing. We're just playing here. It's no big deal if you don't feel anything now. Like it's okay. I'm just kind of exploring this. So that's one piece, but also sometimes it can be a lot for them to feel and really slow down enough to not just reach outside of themselves for somebody to fix them, fix this pain, fix their suffering. It's like, well, let's work on what's here, like what's already here, and what we can notice about what's going on with yourself, and to do that healing ourselves, right? We can only heal ourselves. Nobody can do that for us. And that could be a really intimidating, overwhelming process for people. And that's why it's really important that pacing, or we use the word titration, right? So doing just enough, because otherwise it can just be too much. And then people are like, this is crazy. I don't want to come back to this therapist.
Right.
Yeah, so there has to be that balance, but can be so transformative for that client's experience of their body, helping them get out of that hypervigilant state, right? So their pain sensitivity gets to come down. Again, it doesn't look like we're doing that much different, but there's so much different going on underneath the surface that it can totally transform their results.
I want to get a little bit into kind of defining trauma, because before we started talking, the word trauma to me is, major car accident, sexual abuse, child abuse, any or verbal abuse, like I think bigger, big trauma, right? Death of somebody, a loved one. But today I just read your recent Facebook post about, it can be like an old ankle sprain, or a car accident that, not necessarily a major car accident, but something that and your body kind of stores that. Can you dive into that a little bit and talk about, that there's all kinds of trauma, and how that can affect our body?
Yeah, totally. That was a really important piece that I learned too, because, we do often think, oh, trauma is the event, right? Trauma is the thing that happened. It's the big T, or as we refer to it in the Facebook group. If you saw that Facebook Live, I did a Facebook Live in this group that I host about big T and little t, and that there's the big T, as we think of as the big events, the big car accident, sexual trauma, a major loss, right, which are absolutely traumatic. In those situations, if somebody's not able to recover, they are often, or can be, diagnosed with PTSD, right, which is more of that formal diagnosis of trauma. But then on the other hand, we've got the little t, which are, as one of my clients described it as, death by 1,000 cuts, that phrase. So it's just a little bit here and there. So for example, this client, she had experienced a lot of emotional abuse from her mother. And it wasn't, major abuse that you would think of, certain name calling and things. It was just a little if you've ever been in an emotional abusive relationship, it's just the little cuts here and there over and over and over again. You're like, oh, that's okay. They didn't mean it. Oh, they were just stressed and they said it. Right? Making up excuses, and that can accumulate over a long period of time. So that's the little T's are typically those maybe smaller bursts of stress or trauma or pain that can accumulate into big things. And it could be accumulation from all different points, like an injury and then a job, maybe a job loss, and then, a little bit of abuse in a relationship, right? It can all start to add up. What gets tricky with the little T are a couple of things. Is one that people will minimize the little T, right? They're like, well, it's not a big trauma. I didn't lose my entire house, even though sometimes the little T's can have more impact, especially because they're not more easily diagnosed as PTSD. So people minimize it. Oh, it's a little trauma. It doesn't matter. But again, like the little T can manifest sometimes even stronger and more intensely, where clients might be having symptoms of little T more so than if they had one major big trauma. So that's a really important distinction, is knowing, there could be lots of different ways that we can be under trauma. And when you ask the definition of trauma, it's not the event, right? It's how our system has processed that event, how we've absorbed that event, how our psyche, our brain, our nervous system, and our body has taken that event in. And we all have different capacities for dealing with stressors and traumas. So that's an important aspect too, is knowing that, even if something's like not that bad, it can still really, really impact us, and being cognizant of that and compassionate for ourselves.
How do you, I'm gonna have you take this two ways. One, for a client, like a one-on-one client who's coming to you for treatment or to work with you. And two, as a provider, what are some common things that maybe a client might look at themselves to make sure that they inform the provider, and or a provider could potentially ask their client, to see if this stuff is if we need to, how we need to address it better?
Really good question. So I have an intake form. I was asked this. I did a talk recently at University of Florida, and they asked me that too. I think actually the professor had asked me, what do you do when you're taking on clients? Like, do you ask them to go into their detailed trauma history? And when it comes to being trauma informed, because we're not directly treating trauma, it's really important. Trauma informed care isn't treating or healing trauma. So with trauma informed care, we don't necessarily need to dig into all the things. And sometimes the clients are going to be really uncomfortable to share those things with us, especially if they're coming to say PT and they're like, why are you asking me about my trauma history? Like my knee is hurting, because the patient or the client don't understand those connections. A lot of this is us educating the patient. So on my intake form, I'll ask them, do you have a history of, physical abuse? Sometimes I'll ask that, or physical trauma, emotional, sexual, and I'll leave it just open-ended. And I just say, share as much or as little as you want, so then I generally know. And then when I get on a call with them, we'll go over it a little bit, and I might just, say the statement that they said in the intake form and kind of pause for a little bit, see if they want to go a little bit deeper. But I never really ask. I just kind of, the way that the conversation is shaped is I allow space for it to come up, which gives me more information, but I'm never, ever probing. It can be really uncomfortable for that client to really go into that, especially if it's not fully healed. And if they ask, why did I have to answer these questions, or I left these blank, I didn't feel like it was really necessary, then that's also a good time to say, like there's a lot of research and studies connecting trauma and pain and this hypersensitivity to threat. So sometimes just that little bit of education will help them open up.
That's it. I think a lot of times people, like even just on a basic history form, it's, blood pressure and cancer and diabetes, other injuries. And people are like, oh, I had no other injuries. And, oh, but then like 10 sessions in, they're like, well, this back surgery I had, and like,
right.
And that, even that, like, I mean, because it is like just any kind of surgery, like on your body, it's an insult to your body and it has to recover. And I think a lot of times we either we forget it because it's not bothering us, which,
Right.
okay, that's a good thing, but that may affect how things move. And I find that frequently they're like, oh yeah, well, of course I had this. And like, oh, that's a pretty big surgery. That's great. Now let's figure out where we go from here on that. But
I tell them sometimes like that, like, even if they don't express everything on the front end because maybe they forget, right, which is really common, it will often show up. Like if there is that relationship, like I think I've posted that Tara recently in the group of like, it's not surprising when all of a sudden we're in a certain position and my client's like, I had a car accident when I was 20. And I'm like,
yeah.
Okay. And I'm like, and I had to do with my neck. We're doing this neck thing.
Yeah.
It's okay.
That's,
Yeah,
I think, and that, just that response right there, like, okay, yep, we're going to acknowledge it and we're not going to necessarily dwell on it and dive deep into it. But like, and if you want to share more, great. And we can, I think that's a key piece for all of us to remember as we're treating, and for clients to know, like, too, like, if something comes up, it's okay. You can share it or not. It may impact how your body is moving and feeling, and doesn't mean that we're necessarily going to go in and dive into treatment at that spot, or whatever, but if we can help that to kind of process through your body, it might help you throughout to feel better. So and to again, share what's comfortable for you, because you have to go through it and live it. And that
one thing one of my favorite mentors said, his name is Dr. Perry Nicholson of Stop Chasing Pain. He's fantastic. You know Dr. Perry?
Yes, he's awesome. Yes.
Great.
And yeah, he's awesome.
Yeah, he's so smart and brilliant, and he does some things that are kind of outside the norm, which I love. Like I just love learning from him. He's been my teacher for years. But a quote that he said, I think it was directly from him. He said, "The body is under no obligation to make sense to us." And that always stayed with me, because when I'm working with somebody with complex symptoms, complex pain, complex trauma, things are going to come up, and we don't necessarily have to, our logical brains want to analyze, like, well, this is connected to this, and blah, blah, blah. And I saw this woman, she's pitching her marketing, and she said something like, I can tell you where all of your trauma is stored in your body and exactly where it came from, and da 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 da. And it's just like that's just literally false. We don't have that capability. Like we just don't. And that's okay. Like the body is a mysterious thing. Our human beingness and everything about being a human, there's some mystery to that, and we're still learning and growing, and that's okay. We don't have to know all of the answers. We just have to continually meet what's there. Is a really big part of trauma-informed care, right? It's not necessarily digging into all the things and ripping it apart. It is, okay, well, this is coming up in the moment. What can we do here now to use our skills and our knowledge to work through this, instead of allowing it to create more problems or allow it to create more disease or symptoms?
That's awesome. Yeah, Dr. Perry's, he's got some, if you don't follow him, go follow him, because he's got some amazing stuff. We've already talked about kind of starting to tune into your body, and how, like, just being aware of what's going on. Are there other tips that you could give clients, or providers who are treating too, but tips that, as far as addressing it on their own? I'll say, like, I can tell when I've had a stressful day or something, and a meeting, and like you can just feel the energy kind of absorbing into you. And a lot of times I have to like go in the back and right now take off my mask and kind of breathe over the sink for a minute, take some breaths so that I can then keep going on. But are there other tips, like for clients, what can they do to take the first step in seeing when things come up and where?
Yeah, that's a good question. There's so many different practices to help develop that relationship. Essentially, is what you're saying, that relationship to your body, what you're sensing. One practice that I really liked that I learned from somatic experiencing, which maybe some people here know about SE. I think you know about SE. We talked about SE.
Yeah.
So one of the first practices we did when I went to that training, I flew out to somewhere on the outskirts of Philly, and we were in this beautiful like retreat center with all this bamboo. I didn't know bamboo could be so luscious out in Pennsylvania, but there it was, like bamboo everywhere. And one of the first exercises that we did there, we're in this cohort of like 30 people or so, is they just said, okay, take a partner and you're going to wander around in this beautiful retreat center. And they said the point of the exercise is one person. You're not going to talk at all. There's no communication. You're just going to be a witness for that other person as they start to just observe their external surroundings. So that's sometimes the first part, is just somebody in hypervigilance and a trauma response and stress. They're all in this hypersympathetic state most of the time. They're not going to be fully present in their world either, nonetheless for themselves, right? So the first step is let's orient even to our external environment. So the exercise, and you don't need a witness to do that. You don't need necessarily a person with you, but it was so beautiful. It was lovely. Is we just walked around this beautiful space. It doesn't have to be a retreat center of bamboo, but even outside in nature is just orienting. It's called external orientation. What is around me, you know? So even in a clinic, what is around me in the room, taking stock. It's a natural phenomena that we do when we walk into space. You know, we want to orient, is everything safe? You know, animals do that as well. So that was a really beautiful practice, is just taking that time to orient externally, focus on the things that you might resonate with. Oh, it's a really pretty tree, or, you know, I'm looking outside my window now. So that external orientation can be really helpful, number one, to just be more present in and of itself. And then the next phase would be trying to be a little bit more present with yourself, with your internal body. Okay, now I sense my external environment. Okay, I'm observing outside my window, I'm observing my room. Okay, now I'm observing this seat, and then I can observe my body sitting on this seat. Oh, now I'm like paying attention to my back resting on the pillow, right? So there's this kind of cascade of awareness that starts to come, but very organically. It's not this kind of forced, pay attention to your feet right now. You know, sometimes that can be too much. Is just, let's see what happens. So much of nervous system regulation is also, how can we facilitate that organic downregulation? How can we facilitate organic, spontaneous regulation by just simply paying attention? So that orientation game, so again, we call it external orientation to your surroundings, and then internal orientation. And then the next phase would be, can we also be attuned to our environment and tuned to ourselves at the same time? Can we build our capacity to sense both? Would be kind of the next phase of that. But that, I don't know if that's helpful. That was a little kind of a long-winded answer, but that can be helpful practice for some.
Yeah, and it's easy to do everywhere. I mean, there's I hear talk all the time of, you know, how important it is to get outside and experience a sense of that, like walking barefoot outside, or walking, you know, just having the sun be on your skin, you know, for a short period of time. And you know, I do it myself too. I remember, like, through COVID, I made it a point to, like, not wear my headset and not listen to anything and just get outside and walk, because I just needed that. Like, we have stuff coming at us all the time, and you know, just to have that quiet time to, like, you know, smell, taste, touch, feel, and just and hear, you know. And I think we don't do, like, I think just taking a little bit of time to do that every day can do wonders for our body. And I don't do it enough, so I'm preaching, but but I do. I think it's really important.
What's interesting is when we start to enter these practices, it can feel almost, I don't want to use the word threatening, but it can feel a little bit like that, like, oh, I don't want to do that right now. I have all these other things I need to do, right? There's like a charge that actually can develop from slowing down. You know, there's this thing of like, okay, we're going to take a deep, long breath. And I very rarely will ask somebody, take a really deep, relaxing breath, because sometimes like they don't feel like that's an organic thing that wants to come up. So we kind of let it come to that spot. But so sometimes just those little pockets, like you're saying, is like getting outside a little bit, instead of some people like, I need to take a full 15-minute walk and It's like, just start small. Notice the resistance that might come up to slowing down that we have, you know, because it's like, oh, I can't slow down. I'm in this mode. I'm in this mode. It's like, just practicing being okay with not being in that mode can be a huge changer, even for the little pockets in your day. It's like, oh, it's okay to slow down here.
Yeah. I'm processing that, because I had that exact experience this morning when I tried to sit with my sit and just kind of breathe for a minute. And I was like, I have so much to do. I can't do this. And so
Exactly.
I gave myself the 5 minutes, and then I got up and did what I needed to get done. And, and hopefully I find that other time through the day. But like finding those pockets, I think to me, like, uh, it can make a difference on, overall. I mean, we, we talk physical like where I talk physical stuff, ankle sprains, knee injuries, and
Mhm.
but like it'll affect your blood pressure, it'll affect your heart, it'll affect your digestive system, like all of that can contribute to chronic pain or everything. So
Mhm.
taking that time to just be aware, and doesn't mean panic about it. It just means an awareness, and it's what does this feel like, and what can we go there?
And it takes time. I say that, when I teach clients somatic practices or body-based practices, I prefer them more integrated instead of like, same with exercise. I often tell clients integrate it into your life. Like I don't know if you know CARS from functional range
Yep.
conditioning. So for CARS, for example, so for those of you who don't know CARS, it's basically joint mobility little exercises that you can do in standing. So I'm thinking as I'm doing this, I'm thinking about the spinal car, right? You're doing the spinal car. Like you don't necessarily have to set aside this like long time to do all your joint mobility car exercises. Like you can also just integrate it here and there. Like one client would do his cars on the airplane, like in the back to his shoulder cars, right? So practicing the integration of it and making it a part of who you are, making movement a part of who you are, and making regulation a part of who you are can really make it less of a task and experience less of that resistance of I gotta sit, I gotta breathe. you know
Right. That yeah. I try to teach, integrating that into the day. And some people look at me like I'm got six heads. Like, why
yes.
would I do that when I'm pumping gas? But like, when else do you have that 5 minutes that you're just standing there doing nothing? So that's cool. What kind of pushback do you get from providers on this? Because I do think we're actually on the flip side, kind of switching a little bit. But there's a very big in our population, in our profession, everything has to be research based, and everything has to be,
Mhm.
it can't be woo woo. It has to be. It's just this, and there's a place for that for sure. But there's stuff that's like that is important to the body that's not necessarily been researched. So, are you getting pushback from providers
That's a super
on how
good
to deal with
question.
that?
Yes, that was something that I was hesitant about when I started learning more about trauma and nervous system stuff. And I really dug deep into how can I find as much science and evidence as possible to,
Right.
for one, like I come from that background too, right? So when my mentor introduced me to nervous system regulation and all that, I was like, what? Like,
Yeah.
but where's the science? I was like that. I was like,
Right.
this is
Right.
science.
Right.
This isn't super evidence based and this and that. And I need all this. And I just kept an open mind. And there is a lot of science on this, and especially more in the past 5 years. Like, this is really like up and coming research that we're getting. Stuff on the vagus nerve, for example, has been around for 20 plus years. Um, I've known about the biopsychosocial model of relief for 50 plus years, and that's been studied, which is, so the biopsychosocial model is taking our biological factors, the physical factors that can impact pain, right? Psychological factors that can impact pain, and our social factors that impact pain, right? So you could look at that as a holistic framework that's already, generally accepted, right? So we have some of that already in the field. And the people that I've talked to, the professionals, they've generally been quite open about it. Then again, we're always in our little bubble. I had one of my friends, he's a surgeon, and he was even asking a pain management doctor that he works with, and an older pain management doctor, he's been in the field 30 plus years. And my friend was like, hey, would you be interested in, trauma informed care and how trauma impacts pain, right? As a pain management specialist. And he said, I don't know. Like, I just do what I do, right? So there are those that are like, I'm
Right.
going to set my ways. This is what I do. This is like the framework I follow. Um, and they can do their own thing. I say I'm not here to convince anybody what to do. More as an educator, I provide information. So always, even with my clients, I say, here, I'm going to give you the options. I'm going to provide some information for you, some education. you do what you want with it. I don't like to tell anybody what to do. Here's the information, here's the data we have, here's the science that I found and the evidence, and incorporate it and see what works. And it can be tricky sometimes, when people are in a clinic environment. And, I remember when I worked in PT years ago, I said even to a client, like, she was getting headaches a lot. I said, maybe I was like early 20s, and I was like, maybe you should drink like coconut water. I heard it has electrolytes. And my boss got very upset with me. I loved my boss, but he was like, that could be a legality thing, liability thing, right? Like, that's out of your scope. So sometimes people might run into that a little bit, maybe. Right. Maybe they feel like, oh, if I'm incorporating trauma-informed care, I'm doing mental health work. When I spoke to actually the pelvic floor therapist that you referred me to, her and I had a fantastic conversation, by the way. It was super, super great.
Awesome.
And I quoted something she said. I don't have the quote right in front of me, but she said something like, as physical therapists, like, we're also mental health providers. Like, it's just all together. Like, no, we're not healing and treating trauma. We're not a clinical psychologist. We're not going into all that, but we're treating a whole person. Like, we can't isolate. Like, the mind and body are intimately connected. So the more we can at least understand that aspect, the psychological aspect, the physiological impacts of trauma, the better we're going to be as professionals, Like, it's inevitable, in my opinion. And that's why I love this work, because I think it's profound for the provider to feel empowered and know how to work with their clients in a more holistic, integrated way. And then also, of course, empowering and fantastic for the client or the patient who knows their body better and is getting better results and aren't so confused and frustrated by their symptoms,
Right. Yeah. And letting it be okay. Like, this is what it is. And it's maybe it's not normal, but it's normal. Like, it's normal to have these experiences.
Yeah. So important.
Yeah. So I guess my first question is, if someone is a client wanting to work with somebody that's that is, do you have any providers that you refer people to? Or is there a way how do people find someone like this? Is there?
So you're asking, like, how can a client find a trauma-informed practitioner?
Yes, thank you for that. Yes. Yeah.
I am working on that. So clients have asked me, one was even like, Jess, you're a unicorn. Like, I can't find somebody like you. And I'm like, well, I'm trying to create more of me. I said, not me. Like, everybody has their individual skills. I want everybody to kind of flourish in their own profession and their own specialties while incorporating this kind of care and attunement to their clients. So that's why I actually started, one of the reasons why I started that trauma education group for health and rehab professionals is just, can we gather professionals who are interested in this, where we can collaborate, where we can network, where we can learn together. So then, we have a network and we can refer people. So I found a trauma-informed nutritional practitioner that a client is going to, and I was like, oh, fantastic. Like, somebody in nutrition is so important when it comes to trauma, because of all the stuff we can have around body image and shame, and oh my goodness, so much there with nutrition in our body. So yeah, it's tricky. Like, as far as I know, there's no like directory, but I'm happy to back.
Yeah. So get on creating that provider list, and that brings me to, what programs you have that you're offering for others, that either providers or clients that come to find you and learn more.
Computers, the audio went out, so we'll see if the audio is flowing for us. But so you're in one of the groups that I have, which is the trauma education for health and rehab professionals. What it's called is on Facebook. It's free, and it's just a gathering of a multitude of professionals. So we've got PTs in there, osteopaths, massage therapists, a lot of actually clinical social workers, clinical psychologists, psychotherapists, so nurses, surgeons, doctors. So great variety. I'm especially wanting to attract more personal trainers in there, strength coaches, I think, those professions. So that's in there. And then we do live trainings in there, portal basically on trauma education. And then the other piece, is my audio catching everything?
In and out.
Yeah.
Yeah.
And then the other piece is the CE course that I created. You can hear me okay?
Yep.
Okay. So that we occasionally talk about in the Facebook group as well. I am on my way to getting that curriculum so you can get continuing medical education credits as well, which is really exciting. And, you can petition for it for PT. So that is like my little baby, is this 3-month program to really go deep into the skills and the practices. There's so much to explore when it comes to trauma somatic work. And yeah, I'm so excited to teach this material and get it out there. So.
Oh, that's awesome. I can't wait to learn it and learn from you. So where can everybody reach you?
Audio is okay, there we go.
Yeah. How can people reach out and get in touch with you if they want to connect more?
Sure. So my email is this email. You could use hello@chronicpainandtrauma.com would probably be the easiest way, or I think my name shows up on Zoom as Jess Mather, so they can find me on Facebook under that specific name. Those are probably the easiest way. Anybody's welcome to friend request me too. Like occasionally I'll post some things on my personal page. So that'll just be under Jess Mather.
Awesome. And we'll put all that in the show notes and make sure everybody has that also. Thank you so much. I think this is a huge field, I think it's important for all of us practitioners to, even if we don't dive deep into it, to be aware. And I appreciate that you're bringing the awareness to all of us. And so thank you very much for being here today, Jess. I appreciate it.
And sorry for the technology glitches. I'm impressed that I was able to hop right back and my computer cooperated. So hopefully it all transitions smoothly here and we're good to go.
It'll flow. Thank you so much. And everybody, don't forget, when in doubt, breathe it out. Take life one step at a time. And as my friend Drew Kelleher said, you are responsible for your own vibes. So go embrace the day. Have a good day, everyone.
Awesome. Yes. So